Hey guys, Dr. D here, ER doctor turned psychedelic medicine enthusiast. I just wanted to share with you a little bit about how I came about in this space where we give ketamine to treat depression, anxiety, and PTSD. So I've been an ER doctor for over 20 years, and in that setting, I've used ketamine all 20 years, really closer to like 25 years, to sedate mostly children for painful procedures because ketamine is so safe that that's our go-to drug. Literally 999 times out of 1,000, if you have a 5-year-old that comes to the emergency department with, let's say, a laceration that goes through this border here of the lip, or a broken forearm, right, where we have to sedate the kid and adjust to make sure that we get the bones back straight, 999 times out of 1,000, our go-to drug is ketamine. Honestly, it's probably 1,000 out of 1,000. But we've used it to sedate children, and it's wonderfully safe. It's safe because you maintain your protective airway reflexes. That means if you were to vomit, let's say, you would cough and sputter and clear the secretions. Whereas with like general anesthesia, like in the operating room, or even propofol, you know, that drug that caused Michael Jackson to die, even with in those situations, you do not maintain your protective airway reflexes. You can lose your desire to breathe. But ketamine doesn't really do that. I'm told that apparently even in developed countries, they've used ketamine to take out an appendix because it's got great pain relief, you're disconnected. So they've done that when they didn't have like an anesthesiologist or a nurse anesthetist around. So wonderfully safe. So then how did I come to use it in our office? Well, in 2020, I was really burned out in the emergency department, like frustrated and just not healthy. And so I went to a clinic about 2 hours away and had ketamine therapy myself there. And you know, what I found was, the infusion was fine. I found it pleasant. The very first thing that I told my wife when I was finished was, I said, I want everyone to do that, because I felt good. I felt empathy. I don't know, I just felt good. But then I noticed when I went back to the emergency department after that therapy, yeah, the shifts were still hard and I still didn't like it, and I don't do that anymore. But it didn't grate my soul like it had. It wasn't as hard. I had resiliency in that. And I think that's the thing that we all want. No drug or medicine is going to make life full of rainbows and butterflies, right? There's still going to be hard days. We live in a broken, sinful world. Life is hard. But what we want is resiliency in the suck. We want that ability in order to be able to get through the hard. And that's what I can tell you that our patients see most commonly. They start seeing life doesn't feel as hard. I don't feel as overwhelmed. I don't have an elephant sitting on my chest anymore. I don't wake up with a sense of dread or crushing anxiety. Life can still be hard. I had a patient who told me, like, hey, I figured out that I can be worried and concerned and yet not go down the rabbit hole. So he and his wife had found out that their 28-year-old son had testicular cancer. Like, well, you want to experience some angst with that. You should feel bad and worried and concerned about that. You don't want a drug that makes you go, whatever. But the key is he maintained his resiliency. He was still able to be strong and support his wife and his son through that journey without coming undone completely. And so I just wanted to share with you a little bit about why I do this therapy in my office, my personal experience. I can tell you that when I had my first infusion, I felt like I was floating through color. You know, I had a patient recently tell me that she felt like that she was in outer space during her infusion, but it was pleasant. And so, yeah, to go from the emergency department use of ketamine for sedation, for painful procedures, to using it to treat depression, anxiety, and PTSD, this is the coolest thing, honestly, that I've ever done in medicine. And I've done some cool things, but seeing the results that people have, the stories just keep coming in, and I just see the transformation, and I see a person's countenance change. I just had a lady here earlier today for her 6th infusion, and she's just brighter. She was so riddled with anxiety and depression, and now she feels like that she can breathe, that she's not so overwhelmed, that she can actually go out and go shopping and not just stay at home in bed trying to unplug. So if there's something that we can help you with, reach out to our office, alphaomegawellness.com, or call or text 317-874-6235. We'll get you in for a consultation and see how we can help you.